Hello everyone and welcome to another one of our live sessions. If you're joining us from the United States, Canada, or abroad, we're so glad to have you here with us. Our goal here is simple, to give patients like you access to world-class healthcare in Mexico. Care that is safe, specialized, and more affordable than what you may face at home. When most people hear brain surgery or spine surgery, the first feeling that comes to mind are fear and uncertainty. We imagine long recoveries, high risks, and overwhelming costs. But medicine has changed. Thanks to minimally invasive and endoscopic techniques, many of these procedures are now safer, faster, and less disruptive to patients' lives than ever before. And here in Mexico, surgeons with international training are bringing these innovations directly to patients. That's why today's session is so important, because we're going to hear directly from one of the specialists leading this transformation, someone whose work bridges brain and spine care and who is passionate about improving patients' quality of life. It is my honor to introduce Dr. Carlos Alberto Mendoza Garcia. Dr. Mendoza is a board-certified neurosurgeon with advanced training in both brain and spine surgery. He completed his neurosurgery residency at the prestigious Hospital General de Mexico, Dr. Eduardo Lisiaga, where he also served as chief resident of neurosurgery. His international training includes a rotation in vascular neurosurgery at the Federal University of Sao Paulo in Brazil and participation at the Congress of Neurological Surgeons in San Francisco, California, where he presented original research on complex spinal tumors. He is also trained in skull-based surgery at IMSS Siglo XXI, spine surgery at the National Rehabilitation Institute, and functional neurosurgery at the Hospital General de Mexico. Today, he practices at the NewroSpine Institute of Spine and Neurosurgery in Querétaro, Mexico, where he focuses on minimally invasive approaches to complex brain and spine conditions. Dr. Mendoza, welcome. It's a privilege to have you with us.
Oh, the privilege is mine. I am very glad and I'm very excited to be here with you.
Oh, thank you. It's so nice. Dr. Mendoza, you've trained in some of the most respected institutions in Mexico, Brazil, and the United States. What first drew you to neurosurgery and what keeps you moving forward in the specialization?
Well, there's a very nice question because when I started my career in neurosurgery, the first time that I see the results of neurosurgery was amazing. I have the lucky of look a patient that has 21 years old, but previously he has 10 years before suffering from disease, epilepsy. Continuously he have seizure and continuously, and even if he has drug treatment, we treat different drug treatment, he having behavior and he continue with seizure and apparition and epilepsy. Then the team perform epilepsy surgery and the man get better quickly and stop the seizure and the epilepsy. So it was amazing for me because the neurosurgery changed the life of that person and get better. And he come back one time to the ambulatory consult to say, hello, I'm okay, I stopped to take the medicine. Before that, we say stop the treatment and then say goodbye, continue his life. It was amazing.
Yeah, I can imagine the impact it had on your early career.
Yeah, it was very amazing, and it makes me love the neurosurgery, really.
And talking about your origins, why did you choose to focus in both brain and spine conditions, from facial paralysis to complex spinal procedures?
Well, there are some things that have been navigating my life in neurosurgery, but I think the the thing that I live in neurosurgery is that I am here. I am there when the patient needs me. So in emergencies or in ambulatory consult, I have very lucky, and I am very, very glad to be with treating the patients and to get better them.
And speaking to your values, can you tell us about a moment in your career that shaped your philosophy as a neurosurgeon?
Well, the moments that shape my philosophy, it started so much time before that I get married, before that I get a lot of things in my life, because I look the powerful and the responsibility to do the neurosurgery, because it really, you have a lot of changes in the patients, and always you have a lot of choices to do some different treatments in the patient. So I believe that the principal or the most important thing is that I see the changes in the patients to get better, and it helps me ever to get the best treatment for them, to continue improving them.
Yeah, I imagine it's a motivator and inspiring to see patients move forward. Talking about your training, how has your international training, including rotations in Brazil and the United States, influenced the way that you practice medicine here at NewroSpine?
Well, when I was in Sao Paulo, it was very funny. The people, I love the people from Brazil and the people from United States, because always the people that received me, that told me, come with me and I will teach you, and I will teach you the techniques that I do. Well, I am very glad with that people,
right?
Because they are very, very, very professional, and they do the most actually treatment, and they permit to me to learn from them. So when I was in Sao Paulo, the first step was to be in the surgical operation, in the surgical room in the morning, and after the surgery in the afternoon, we went to the ambulatory consult and to give. But if you were not in that places, you should be in the laboratory to doing improving of the skills of dissection of the brain, of dissection of the skull, approaching the skull. So it was very, very nice. And when I was in United States, the same thing. So it helps me a lot to improve my skills and to see what is happening in the world. So it doesn't mean that in Mexico there is not good attention. In Mexico, I assist to some institution that you say before, but they are very, very amazing how they do the work and how they do the program.
I'd like to speak a bit towards minimally invasive surgery. Most of the times when people hear about spine surgery, brain surgery, they're imagining long recovery times and high risk. But can you explain in simple terms for our audience what minimally invasive surgery means today?
Well, it's normal to believe that things, because all the people knew or hear something that the previous surgery in the spine or in the skull was very difficult, right? And with a long recovery time. But actually, with minimally invasive surgery, with endoscopic procedures, the people and the patients can get better soonly. So the principal difference is that when you perform an open surgery or traditional surgery, the bleeding is just a little high. I don't know, it could be like 500 or 600 milliliters. That is not bad in some cases, okay? But actually, I think 99% of the cases can be treated by endoscopic or minimally invasive surgery. And what are the results? The bleeding is very lower, 20 milliliters, and the recovery time you perform the surgery in the morning, and in the afternoon the patient start to walk and start the physical rehabilitation. So there is a huge difference.
And what is it about minimally invasive surgery that changes the way that you approach delicate structures like the brain or spine compared to traditional open surgery?
Well, there is very interesting question, because the actually minimal invasive surgery with endoscopic procedures, it helps you a lot, because you have the surgery, you are making the operating, and you are looking high quality TV, and you can see the structures very, very increased in size. And if you can decompress, you can, in the spine, you can decompress, you can remove the tissue that is compressing the spine, or the nerve roots that is getting out from the spine. And in some cases, the disc, intervertebral disc that is growing, that is herniated, you can remove by these procedures, and you can do safely, because you are looking better with a high definition, and it helps you to get a better decision during the surgery. So it is a huge difference.
So you mean to say you have an even better optical view with minimally invasive endoscopic neurosurgery?
Yes, because you open lower, the open of minimally invasive is like a half inch, a half inch, and you can see just a lot, a lot of structures.
Right.
Okay, and it's very, I don't know if it could be like a word that it doesn't exist, but it's really, and with the endoscopic you can see a lot of things in the spine. It's very nice and it's beautiful.
It's a great way to say it. When talking about technology and minimally invasive surgery, how do you balance technology like navigation systems, imaging, or robotics with the human element of surgical decision making?
Well, it's very nice to get closer both sides,
right?
Because the human being, the person, the doctor, have to do a real clinical advice, physical examination correctly, because the patient always comes for a pain that is worse than the others. Okay, so to do or to perform clinical advice, or a clinical with all the symptoms, with all the signs that you are seeing in the patient, you compare that information with the MRI or other studies that you are doing to the patient, and after that you make a match. And if all is match, you can make a correct diagnosis. And after that, if you have a correct diagnosis, you can do a better treatment for the patient.
Right.
So this is the first step, that you can join that both sides. And the other way is when you go to the operating room and you can help. Well, actually, we do a lot of surgeries with endoscopic and a lot of tools with intraoperatory neuromonitoring. That it means that the people has some information from the brain on all the nerves of the body, and you are doing the surgery, and the people that is doing that work, it tells you the patient is getting better, the conduction of the brain and spine, or take care because there are an alert, or there is an information. So it helps a lot, because it makes to do better decision making during the surgery. And the other things, to do the navigation and to do the robotic surgery, it helps a lot, because you can perform that and it helps to your work. So I think the continually improvement in the technology, it will continue helping us.
It's incredible the way you explain it. How would you describe the recovery process for a patient here at NewroSpine? What can he or she expect from a minimally invasive procedure and the recovery that entails.
Yes, the minimal invasive surgery in spine, well, the normal thing that happens in our patients that come here to make the surgery, the patient start the previous night to the surgery, start in the hospital. In that place, it comes the internal medicine doctor, and he makes a double check. He looks the patient previously, but in the hospital makes another consult, and he check all the blood tests are okay, the blood pressure are okay, the things that he does.
Right.
And it helps us to, because he see other things that we didn't see, right? Because he is other specialist. After that, we make the surgery in the morning, and in the afternoon, we get the patient to start the physical rehabilitation and start to walk. That is amazing for the patient, because they believe that they are going to be in the bed for a long time. But now we get up the patient, like, get up, man, let's go and continue with your life. And after that, the next day he goes to home. Okay? So it's the first step. The second step is the 15 days after the surgery. He has some exercise that start here in the hospital, and after he does that exercise in the home or wherever he does, and after he comes to another consult, and we check the wound healing and that things, and after that he start a physical rehabilitation, but we can say more accurately, and that's normal.
I'd like to speak a little bit about brain tumors.
Yeah.
What would you say are currently the best treatments or procedures for patients that have brain tumors?
Well, the patients that have brain tumors, the more important thing is to detect them, because there are some tumors in the brain that doesn't detect because they have headache, or they have numbness, or they have loss of vision or something like that. But I think, and I see in the other places that I have been before, in Brazil or in USA, that the patient doesn't look that symptoms, because sometimes the symptoms are very low, and it's normal. The patient get another headache, I will check an aspirin or something, right? So this is the first step, to detect them. When you detect, you have to make the difference between the tumors that are inside the brain and the tumors that are outside the brain. It means the tumors that goes directly from the skull, from the brain, from the sulcus and gyrus, that makes the sense, the motor, and the visual fields, and the tumors that comes from the skull and comes from the meninges, and that compress the tumor, the brain. Okay, the difference is very important. Because of that difference, it will be the different treatment that it will helps the patient. So the more actually kind of treatment, it could be by minimal invasive surgery, or surgery by stereotaxy, or navigation, or even some kind of tumors with endoscopy by the nose to arrive to the skull base. So there are a lot of tools that actually helps the treatment of the brain tumors.
And moving on towards hydrocephalus. Hydrocephalus, as we understand, involves a buildup of fluid in the brain. How do you explain this condition to patients in simple terms, in terms of their symptoms and what's physically going on inside their head?
Yeah, the hydrocephalus, there are different kind of symptoms, but the normal symptoms are headache, distortion in the view, loss of vision, changes in the bladder, or you can the sphincter, you can control them, and sometimes disturbs in the normal way of life, something just like that. And what it means that the liquid inside the brain that is inside the ventricles get increase. You have to study what is the cause of that.
Right.
And when you have the cause of that, you can give the treatment of that. Actually, there are procedures like endoscopic ventricular procedures that relieve and make another way to remove the fluid without the need to put a valve. That is the normal treatment of the hydrocephalus.
So you're talking about surgical options today.
Yeah.
How would you describe the minimally invasive neurosurgery options and how they improve outcomes for patients with hydrocephalus?
Well, the improvement of hydrocephalus with endoscopic procedures, it's better because you remove the risk that are around the valves. When you put a valve, there are risks, not very low, but not very hard to put a valve, because you can have infection, you can have exposition, or getting out the valve from the skin or in the abdomen or something. So you remove all that risk and you continue doing the work during the endoscopic, and you can make another way to give the liquid inside the brain to get another way.
What's really, when we talk about herniated discs,
Yeah.
What's really happening when someone has a herniated disc? And why does it cause so much pain?
Well, it's a good question because a lot of people has herniated disc and they don't have symptoms. What is the difference?
Right.
The difference is when you have the spine, okay, and you have here in this place, in the middle line,
Right.
if you have the herniated disc in the middle line, it is very probably that you don't have so much symptoms,
Okay.
or you will have lower pain, but in the most of the cases, it will get better with physical rehabilitation.
Right.
But the problem is when the herniated disc go from this side, from the foramen,
Okay.
that is, or when the herniated disc is near from the nerve root, or when the disc is compressed all this, or when the backside of the vertebra is compressed, okay? So it is stenosis or herniated disc.
Right.
There are two differences. The herniated disc, when get better, when get closer from the nerve root, is the symptoms, and it gets inflammation around the nerve root, and it continues until the patient gets the worst pain in life or in the legs or something. And the physical rehabilitation, there is no good way to get better. You can do it, but you will be 3 months or more with pain, and it's very probably that it returns. So when the herniated disc is near from the nerve root, it's better to remove.
And how does endoscopic surgery resolve this problem? And what kind of results can patients expect?
Well, it's very nice to see the endoscopic procedures and to make the compression of with endoscopic the herniated disc, because you can see directly the disc herniated with the long view, and you remove the disc or you remove the ligaments that is compressed the nerve roots, and you can get the help from intraoperative neuromonitoring, and they tell you they get better the results of the information, okay, and you can see how is getting out the disc, okay. So it's very important to do both things, and you can get a better treatment with that way.
Now, spinal stenosis, whether it's cervical or lumbar, can affect older patients. How do you help them regain stability?
Yeah. The compression of spinal stenosis, even if it is in cervical or lumbar stenosis, you can perform by endoscopic procedures. Okay, actually, we remove the ligaments and the disc or the bone, even the bone that is compressed, the nerves and the root nerves, by endoscopic, and it gets better soonly. And sometimes it depends of there is only spinal stenosis or there is instability on the spine. Because if there is instability in the spine, it could be need that the patient needs the endoscopic and needs a screw fixation or arthrodesis. So, but it depends, okay? If there is only stenosis, it could be better to do only endoscopic surgery and to continue his life, the life of the patient.
Now, we'd like to move forward towards Parkinson's disease.
Yeah.
Or tremors.
Tremors.
What are some options for surgical treatment for Parkinson's disease nowadays?
Yeah, the Parkinson's disease actually have been a lot of change in the treatment. One of the most important thing is to know or to get clinical advice, to clinical examination, to know if the patient is a candidate or if the patient, it's good to do a surgery, because in patient that has Parkinson's disease with so much time and the functional ability of the patient is lower, it could be not a good option. It's very important to be honest with the patient, with the physical examination. After that, if you have a patient that is a good candidate to do a surgery, actually we make a surgery from deep brain stimulation on the subthalamus nucleo or in the globo pálido interno. Okay, so that sites in the brain we have seen that have improved a lot the normal life of the patient. It depends if there is more tremor or there is more rigidity in the extremities. So it depends of the highest clinical symptoms. It's where we decide with the committee where we are going to put the DBS.
And what does safety look like for these type of procedures? What are the risks associated?
Yeah, this is very safety because we make the surgery with a lot of person in the team. So first we perform this surgery between 3 neurosurgeons. Okay, so functional neurosurgery and others. Okay, and after that we make the surgery with awake patient. Okay. There is some parts of the surgery that the patient is only just a little dream, for say something, but all the surgery the patient is awake. Okay. After that, there is a neuromonitoring, and we make a previously evaluation of where are going to put the DBS. Okay, and it's very safely and is very helpful for the patient.
When we talk about aneurysms, that's another like high stakes condition, right? How does modern neurosurgery make these procedures safer and more effective than they were just a generation ago?
Yeah, the first step, I repeat, is to detect. To detect is the first step, and after to detect, we should evaluate if the aneurysm is a candidate to make different procedures. Actually, the procedures of treatment of aneurysm is almost endovascular procedures. It means that you can make a puncture in the artery and the femoral artery and get the catheter until the carotid artery, and then you can arrive to the site of the aneurysm, okay? And you can put coils that is like metal that gets into the aneurysm, and it replaces the vascular site of there, and the normal blood continues his normal way. But it sometimes the patient have aneurysm that is with a neck wide or a high neck of the aneurysm, and it can be done that procedure. And that in that point, we have to put an diversor or like catheter inside the brain, inside the vessel, and the blood doesn't arrive to the aneurysm and continue his normal way.
Now, talking specifically about medical tourism in regards to these procedures, what reassurances can you give a patient about safety, language, and continuity of care once they return home?
Well, it's very important, that question, because this is a place designed to treat patients of neurosurgery and spine procedures. This is the first step, and this is the first hospital in Mexico that has all the things to treat them and to take care of them.
Right.
Previously to the surgery and after the surgery. In this hospital, you have MRI, you have CT scan, you have electromyography, you have a lot of things, and the most important thing, you have the personnel that is related with this disease all the time, because it's very frequently that we do these surgeries.
Right.
So this is the step. These are the steps, and the second step is that the person that received the patient, that opened the doors of the hospital, they talk in English or other idioms like French or something. And in the first step, the patient, the person that the nursery, the people from X-ray and that things, to talk in English, or and it helps the patient.
For sure. How does the cost of advanced neurosurgery at NewroSpine compare with the costs of these similar procedures in the United States? And what do patients say about the value that they receive here at NewroSpine?
Well, it's very different because it's the lower price than the United States, and I think this is one point that make the decision of the patient, but there is not the only.
Right.
The other things that makes the patient from other countries. Even I treat a patient from England, so it was very wonderful. Colin. The most important things was the way of treat of the person.
Right.
So I think all the persons, all the doctors, all the nurseries, and all the person that works in this hospital, even if they are from United, even if they are of Canada or wherever side of the world, they treat the person with comfortable, with humility and honestly. So I think it's a good option.
Definitely nothing substitutes service, value of service. What are some of the biggest advances that you're most excited about that are coming in neurosurgery over the next decade, especially in minimally invasive techniques?
Yeah, I think the last 20 years, the neurosurgery has been evolution.
Right.
But now the robotic area, it's coming.
I see.
Now the endovascular procedures from aneurysm it will help by robotic. So I think it will change a lot of things in the normal way that we are looking right now, the neurosurgery. And the robotic, it will improve a lot of things, and it will help like actually it does, but I think it will going to get better.
It's exciting, huh?
Yes.
What could you leave our international patients with one message about why NewroSpine is a trusted destination for neurosurgery? What would that message be?
Well, the message could be that NewroSpine and the people that work in this hospital have been for a long time prepared to treat patients not from Mexico, even from other sides. So it is the most important message to give them, that you are not coming for experimentary or to do something strange. We do the things that make in other countries, but this is an hospital that has all the faculties and has all the tools to treat them. That's all.
Thank you, Dr. Mendoza, for your insights. To our viewers interested in medical tourism, this is what we can do for you. We understand that traveling abroad for surgery can sometimes feel daunting. That's why we take care of everything, from connecting you with trusted specialists like Dr. Mendoza, arranging your flights, airport transfer, hotel accommodations, and even providing personal concierge support throughout your stay. Patients often tell us they're amazed not only by the cost savings, but, as Dr. Mendoza said, by the quality of care and the personal attention they receive here in Mexico. Dr. Mendoza, thank you for your time. We're truly very appreciative of your experience and the feedback that you give us and our audience.
No, I am very glad. I am very excited to work with you, to talk with you, Santiago. It's very nice, and I really enjoy to share my knowledge with you and with your audience.
Thank you so much. And to everyone watching, whether you're just starting to explore your options or you're ready to take the next step, we're here to guide you. Reach out to us today. Send a message, schedule a consultation, or simply ask your questions. We're ready to help you move forward with confidence. Thank you all for joining us, and we look forward to welcoming you soon here at NewroSpine Hospital in Querétaro, Mexico.